A very good evening to all of you all. Hope all are safe and secure. And today's video, the live is on kids, basically kids COVID, and the more serious type of the COVID infection in kids, that is called the multisystem inflammatory syndrome in children's and also neonates. Now, when it comes to the children's and neonates, the COVID infection in children, it is acute infection, and also which affects 90% of the people, 90% of the children's, and it is a mild form of infection. You should remember that COVID in children is very, very mild form, 90% of the patients. And you can have a pneumonia, but it is very rare as compared to adults. The most severe form is the multisystem inflammatory syndrome in children's and neonates. And it usually happens around 2 to 6 weeks after the COVID infection. The children must have having the prior infection before, or we must be exposed to somebody in the house or neighboring places, and he must be asymptomatic. But when he manifests after 2 to 6 weeks, it will be a very severe type. That is called multisystem inflammatory syndrome. It is children. You can also get in neonates also if the mother is COVID positive in the third trimester, and also you can get during delivery time. So basically, COVID in children's 90% is mild, and the moderate version is 5%, and the severe form is just 1 to 2%. So the mild form can be managed in the home isolation with teleconsultation with your doctors. The moderate needs to be admitted in the hospital, and the severe type, which is I'll be telling you in later part, which is multisystem inflammatory syndrome, which needs to be admitted in the ICU setup. Now, when you say the mild form of infection, a mild COVID, it basically have some mild symptoms like fever. It could be cough, cold, running nose, abdominal pain, nausea, diarrhea, vomiting. So mild symptoms it can be. It doesn't have very severe symptoms like what you get in the respiratory discomfort. There's no dehydration in that. There's no confusion, delirium in that. So this symptoms will not be there in mild symptoms, and it can be managed in the home setup. Provide you daily teleconsult with your doctor and tell the updates in a regular basis. Now, whenever you do a home isolations, you have to see you don't require any special medications for this in the mild case. Just in case if you have a fever, you require some paracetamol. You don't require any antibiotics for this. No blood test to be done. No CT scan. You are absolutely not required in this mild case. Just home quarantine, and you should isolate this from your grandparents, and all the people in the house needs to be masking themselves. So once isolation is over, that's fine. That's okay. So the testing which is done is RT-PCR test. You can do a rapid antigen test. If it is positive, that's fine. You don't have to do a RT-PCR test. Or if it is negative, then you have to do a RT-PCR. So mild symptoms you can manage in the home isolation. Now, what are the chartings you have to do whenever you're there in the home isolation? First is temperature, your pulse, your respiratory rate. You need to see the child alertness. You need to see the urine output, any associated symptoms, any activity of the child. How active is the child? You have to know, because the activity, if it is drowsy, because interfebrile period, the child will be very normal and active. If it is not so active during the interfebrile period, that means it needs to be a very serious condition. So that's what you have to do, a charting, and monitor almost on a daily basis, 3 to 4 times on a daily basis. You can do that. And then what you can do is you can send a chart to your doctor, and he will monitor the patients on a daily basis. And once the symptoms are okay, you can, after 14 days, it's fine. So next comes the moderate version, where the red flag signs. What are the red flag signs? If you have a mild to moderate when it's a conversion, the moderate symptoms which are there. If you have a persistent fever for 3 days, the urine output is decreased. When the saturation comes down below 90 degrees, 90, then you have what you call rashes. You can have vomiting, convulsions. You can have swelling on the feet. All these are symptoms which goes in the moderate variety. And when you have these symptoms, you need to be admitted, this the child or baby needs to be admitted in the hospital, and where the doctor will take care of it, where the charting the temperature, pulse, heart rate will be monitored rapidly around on this 4 to 6 hourly basis, where the also the additional investigations will be done, like blood count will be done, the blood culture, the liver function test, renal function test, all other tests will be done in the battery of tests to further investigate this way. And also one thing you have to tell is this patients will be required some if there is a dexamethasone can be given in such conditions. Now, what is a severe form which I'll be telling you now is 1 to 2% which affects a patient is multisystem inflammatory syndrome. Now, the severe form, it is why it occurs, probably delayed occurrence and delayed post-COVID complications, you can say this. And it occurs probably 2 to 6 weeks. It can occur within 2 to 6 weeks, even months after the infection, prior COVID infection. And it can as a present directly with the symptoms. And I'll be telling you what symptoms you have to monitor. The first thing is there is a criteria to diagnose this multisystem inflammatory syndrome. The first thing is you need to have a persistent fever for 3 days. And the age group criteria is, according to WHO, is less than 21 years. Now, what are the two? You need to have two more signs in addition to these 5 which I will be mentioning now. There could be rashes. There could be rashes in the whole body. There could be non-purulent conjunctivitis of the eyes. You can have redness of the tongue. You can have a redness of the lips. You can have what is called, these are the symptoms. You can have swellings of the leg, feet, and the redness also in that area, mucocutaneous involvement. Now, then you can have involvement of the heart. It could be myocardial dysfunction, pericarditis, TROP-TS, the myocardial vessels are also dilated. Okay, this myocardial involvement. Then you have abdominal involvement. Like you can have what you call pain, you can have diarrhea, you can have vomiting. These are the symptoms you can have. Then you have a symptoms of coagulopathy, where you have a raised prothrombin time. Then you have a D dimer which is elevated, and also one more criteria is hypotension or shock. So out of this 5, this 2 needs to be present. Plus, in addition, the blood test, that is the inflammatory markers, which needs to be elevated, which is called a CRP, which is more than 40, and ESR if it is more than 6. ESR should be more than 40 and CRP more than 60. So if it's there, and plus one more sign is you need to have a presence of antibodies in this. So once all these criteria fits, then this is a direct case of multisystem inflammatory syndrome. Now you remember this is called multi-system, which affects multiple systems. It can affect your brain, it can affect your heart, it can affect your lungs, it can affect your kidneys, it can affect your skin. So these are the symptoms you can affect as a multi-system involvement of the whole body. So that's why it needs to be very alerting symptoms. You have to diagnose it at a very early stage, because if it is diagnosed early stage, there is definitely treatment for this. It is life-threatening, but definitely you have a treatment for this. That's one good thing about this multisystem inflammatory syndrome, that if you diagnose an early stage, definitely the child may recover very fast. So if you're in the home, the patient has a baby at home, how to monitor the symptoms? The symptoms, simple thing you should remember, that A, B, C. A is abdominal pain. You can have a B is blood tinge eyes, C is clot, cardiac involvement, D is diarrhea, E is extreme fatigability, and F is fever. So these are the how you can monitor. These are the few symptoms you can very easily remember the A, B, C, D, E. So if you can remember this, it becomes very easy to know the symptoms. Now, what are the investigations you have to do in such cases? Now, since it's a multi-system involvement, you need to investigate in detail. Now, you require the albumin to be done, liver function test to be done. You need to investigate for the kidney creatine, protein creatine ratio. Then most important thing, you have to do the 2D echo, because there is a cardiac involvement in this patients, in this babies or children's, and the coronary vessels are dilated. So you have to investigate by means of a 2D echo. The cardiac involvement becomes very, very important in this, because the heart is involved. That is called a Kawasaki disease in this. The heart involvement is there. So that's why you have to do the 2D echo. Then other investigation, definitely you need to do the CRP, ESR, procalcitonin. Then you have the ILC, you have to see. Now, absolute, you have to do the blood cultures. Then you have to see the whether how is the lymphocyte count. Less than 1,000 usually you can see in the COVIDs. How is the platelets? Less than 1.5 lakhs. You have to all this in battery of investigations you have to do, because these investigations will help us to knowing which system is affected. So because it's a multi-system involvement, all systems can get affected. So one thing is there is no blood test as such to predict whether this condition will occur or no. This is absolute diagnosis based on your symptoms. So if you have one of these symptoms, it can be all symptoms may not be present. There could be few of the symptoms which I mentioned, which can be present in the babies or childs, and that needs to be a very alarming symptoms. Because if it is detected at the early stage, definitely it will have a good prognosis and patients can recover very, very fast. So these are the battery of tests you have to do in case of a. Now, what is the management in this case, such cases? The management, you have a good management. If it is febrile condition, you can give paracetamol. They usually give methylprednisolone in this, and also IV immunoglobulins. And the IV, this management, this IV immunoglobulins, if you have a Kawasaki's disease or you have a shock patient, this is very, very useful treatment, and patients will definitely get relief. Also, if the saturation is less, then you have to give oxygen for this, and you have to maintain a nutrition. You have to maintain the hydration levels also. So these are the few things how you manage this multi-system inflammatory syndrome. Now, you should remember that this multi-system inflammatory syndrome, what is important is picking up early symptoms, diagnosing it, doing the blood investigations, and managing and starting the early treatment. So if you get all these things, and if you can monitor the child on an early basis, the most important thing is follow the ABC. What are the symptoms? Whether you have redness lips, redness of the tongue, you have a red eyes, then you have it could be swollen legs, then you have a cardiac involvement, it could have the coagulopathies, all this, and plus a Coombs test. Now, this condition usually is like a post-COVID complication. It affects usually after 2 to 6 weeks. It is a delayed reaction to the immune response to the early COVID virus. So that's why this is very called a severe form, and it always needs to be have a ICU setup, ICU admissions, where in the ICU the patients will be properly monitored and properly treated. So this is in short about what you call that multi-system inflammatory syndrome, that it is the involvement of multi-systems, and it affects only 1 to 2 patients, 1 to 2%. You should think that most of the time the COVID is in the children's 90% is only mild, and only 1 to 2% is only in the severe form or the multi-system inflammatory syndrome. So probably we are expecting a third wave, and which can affect the babies, we don't know. So most of the people, the researchers which are saying, virologists, they're saying it can affect the children's, and how severe it can be, we don't know as of now. So probably we need to be aware of this condition, that 90% is mild, it can be managed in the home isolation. Only 1 to 2% needs to be in the, it fits in the criteria of multi-system inflammatory syndrome. So that needs to be monitored, and that is important. So this is in short about the multi-system inflammatory syndrome. So if you have any questions, let me know in the comment box. I can answer this at now. So this is multi-system inflammatory syndrome. It is because now we are seeing few patients now in India at present. So probably if the third wave strikes, then probably we can expect more cases of this multi-system inflammatory syndrome. So that's why we need to be cautious. And there is no test as such to predict these conditions. It is based only on the clinical judgment, how aware you are of these conditions. And if your at the home child is there, and if you see any of these symptoms in your babies or the children, you need to immediately report to your doctor. That becomes a big difference, because early treatment and early management has a good prognosis for this multi-system inflammatory syndrome. So if you have any question, let me know in the comment box. I'll be answering that. If you found this video useful, please share to your friends, because they can get aware of this condition, multi-system inflammatory syndrome. They can also be knowing that, because we can expecting a third wave, so they can be also aware of it. So if you don't have any questions as of now, if you can post your question later in the comment box, I'll be definitely answering your questions later on. So thanks for watching this video. See you for the next live session.